There is a need to be aware of the risks posed by blood and airborne infections which come with people and patients to hospital. Healthcare-associated infections may get in a healthcare facility while receiving treatment. Several types of bacteria and virus can cause infections. These infections are a major cause of spread of disease and of death. Infection control is the discipline concerned with preventing healthcare-associated infections. WHO definition of healthcare-associated infections. HAI is an infection occurring in a patient during the process of care in a hospital or other healthcare facility which was not present or incubating at the time of admission. Occurs in the hospital staff as a consequence of their work. Infection control. Aim: to prevent the transmissions of common infectious agents to healthcare personnel, patients and visitors in any healthcare setting. Assumes blood and body fluid of any patient could be infectious. Infection can spread in many ways. For example, a bloodstream infection can occur when the patient has a central line in the vein, a slender tube used to deliver fluids or medications into a larger vein near the patient's heart. Bacteria can enter the skin around the insertion site or directly into the patient's bloodstream, where they can cause infection. A surgical wound infection can result when bacteria can get into the patient's incision area and spread through tissues, leading to infection. Pneumonia can result when the patient is on ventilator or breathing machine. Bacteria can enter patient's throat while being placed on a ventilator. A urinary tract infection can occur when the patient has a catheter in his bladder, which is a tube used to drain urine. Bacteria can enter the urinary system on the catheter, enabling the bacteria to travel into the bladder where they can grow. There are methods to control infections. 1. Standard precautions. 2. Sterilization and disinfection. 3. Environment control. Standard precautions. Recommends personnel protective equipment, PPE, and other infection control practices to prevent transmissions in any healthcare setting. Decisions about PPE use are determined by type of clinical interaction with patient. Standard precautions include World Health Organization's 5 moments of hand hygiene. 1. Before patient contact. 2. Before aseptic task. 3. After body fluid exposure. 4. After patient contact. 5. After contact with patient surroundings. Hand washing techniques. Washing hands with plain soap and water for 40 to 60 seconds. 1. Wet hands with water and apply soap or hand wash. 2. Dispense adequate amount of soap to make lather and spread to cover the hands. Rub hands palm to palm. 3. Rub palm over the back of the other hand with interlaced fingers and vice versa. 4. Palm to palm with fingers interlaced. 5. Back of fingers to opposing palms with fingers interlocked. 6. Rotational rubbing of left thumb clasped in right palm and vice versa. 7. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. 8. Rinse hands under running warm water. PPE, Personal Protective Equipment. Gloving. Wear gloves when contact with blood or other potentially infectious materials is possible. Remove gloves after caring for a patient. Do not wear the same pair of gloves for the care of more than one patient. Do not wash gloves. Work from clean to dirty. Limit opportunities for touch contamination. Protect yourself, others, and the environment. Don't touch your face or adjust PPE with contaminated gloves. Don't touch environmental surfaces except as necessary during patient care. Discard an appropriate receptacle. How to don gloves? Select correct type and size. Insert hands into gloves. Extend gloves over isolation gown cuffs. How to remove gloves? Grasp outside edge near wrist. Peel away from hand, turning glove inside out. Hold in opposite gloved hand. Slide ungloved finger under the wrist of the remaining glove. Peel off from inside, creating a bag for both gloves. Face protection. How to don a mask? Masks protect nose and mouth, should fully cover nose and mouth. Place over nose, mouth and chin. Fit flexible nose piece over nose bridge. Secure on head with ties or elastic. Adjust to fit. Goggles protect eyes, should fit snugly over and around eyes. Personal glasses not a substitute for goggles. Anti-fog feature improves clarity. Gowns or aprons. How to don a gown? Select appropriate type and size. Opening is in the back. Secure at neck and waist. Sequence for donning PPE. Shoe covers first. Hand wash. Headgear. Gown. Face mask. Goggles or face shield. And gloves. Sequence for removing PPE. Gloves. Face shield or goggles. Headgear. Gown. Face mask. And shoe covers. So these were the standard precautions to control infection. We now move to sterilization and disinfection. Let's understand Spaulding's classifications of levels of sterilization and disinfection. For choice of methods, the articles can be classified as critical, semi-critical, and non-critical. Critical items confer a high risk for infection if they are contaminated with any microorganism. Most of the items in this category should be purchased as pre-sterilized or be sterilized with steam or any other appropriate sterilization method. Semi-critical items contact mucous membranes or non-intact skin. Semi-critical items minimally require high-level disinfection using chemical disinfectants. For example, glutaraldehyde, hydrogen peroxide, orthophenaldehyde. Exposure time advised by manufacturer should be strictly followed. Non-critical items are those that come in contact with intact skin but not mucous membranes. Low-level disinfectants that may be used for non-critical items, for example 5% phenol or quaternary ammonium compounds, etc. From sterilization and disinfection, we now move to environment control. It is equally important to understand that infection spreads through the environment as well. Infection prevention practices is to eliminate the risk of the transmission of pathogens between patients and the healthcare worker. Use the right concentration for disinfection. Clean all horizontal surfaces of the bed in the room, ensuring that the cloth is changed when soiled. Disinfect all horizontal surfaces of the room by reapplying the disinfectant and allowing for a 5-minute contact time. Allow surfaces to air dry or wipe dry if surfaces are still wet after the 5-minute contact time. Spill management. Appropriate personal protective clothing should be worn for cleaning up a blood spill. Household heavy-duty gloves should be worn during the cleaning and disinfecting procedures. If the possibility of splashing exists, the worker should wear a face mask and gown. The area should be spread with absorbable material such as paper or cloth to limit the spread of the fluid. Pour sodium hypochlorite solution over the area and leave it for 10 to 15 minutes. Then wipe and discard the material in a yellow plastic waste receptacle. Care must be taken to avoid splashing or generating aerosol during the cleanup. After disinfection, thoroughly clean the floor with soap and water and allow it to dry.